Hello everyone. I, Ansari Shahina from College of Home Science Nirmala Niketan of Department of Community Resource Management will be presenting an occupational health disease called Caisson's disease, also known as decompression sickness or the bands. So now let us look what is Caission's disease or decompression sickness. Decompression sickness, also known as the bands or Caission's disease, happens when someone moves too quickly from a high pressure environment to a low pressure one, like from deep underwater to the surface. It occurs because nitrogen bubbles form in the bloodstream and tissues, causing problem. Decompression sickness is classified based on symptoms into three types: bands, chokes, and staggers. However, it is also commonly divided into two categories: type 1 affecting joints, skin, and lymphatics, and type 2 affecting the brain, spinal cord, lungs, or inner ears. The disease was first noticed in 1873 by Dr. Andrew H. Smith, who saw workers on the Brooklyn Bridge getting sick after coming out of pressurized underwater chambers called caissons. The term the bands come from the bent over posture of those affected. In India, decompression sickness cases are rarely or does not reported, while in the US it's reported about once in every 5,000 to 10,000 dives per year, with around 10% of cases being fatal. Some of the most common signs and symptoms include: first, pain, sharp or deep pain, often in the joints, muscles, or back, which worsens with movement. Second, numbness and tingling, a sensation of numbness or tingling, particularly in the arm and legs. Third, skin issues. This could be itching, rash, or skin discoloration. Fourth, swelling, particularly in the chest, abdomen, or arms. Fifth, fatigue, unusual or extreme tiredness. Other symptoms could include dizziness, vertigo, difficulty in breathing, chest pain, and ringing in the ears. Decompression sickness happens when nitrogen bubbles form in the bloodstream due to rapid ascent from deep underwater or high pressure environments, not properly decompressing after a dive. Working in pressurized environment like underwater tunnels or caissons. Sudden environmental pressure changes. Workers most at risk from decompression sickness include deep sea divers, underwater construction workers, submariners, aviation workers in non pressurized aircraft, tunnel workers in pressurized environment. For treatment, hyperbaric oxygen therapy is often used. Recompression therapy is also effective in some cases. Additional treatments include administrating oxygen, intravenous fluids, and pain medication, as well as rest and monitoring. In rare cases, surgery may be required. To prevent decompression sickness, ascend slowly during dives and follow standard diving guidelines. Avoid flying within 24 hours of a dive. Stay hydrated and avoid alcohol before diving. Limit deep dives in terms of both depth and duration. Avoid diving if you are pregnant, have a heart or lung issues, or if you have recently injured a joint. So, here are some references that I used to make this presentation. As we approach the end, I would like to showcase my gratitude towards the College of Home Science Nirmala Niketan and Department of Community Resource Management for giving me this opportunity. Thank you.